You, the medical emergency response to a situation like this and what it calls for. Right now, joining us on the phone is Dr. Brent Kaziny
Yeah,
with
but hold on a
Emergency
second. Let me say
Management
this.
at
I don't want to
Texas
call
Children's
again
Hospital,
because
just to give us some insight, perhaps, in what emergency responders would be dealing with, and also that staff that's at hospitals where the children or others who were injured were taken to. Good afternoon to you, Dr. Kaziny. Thank you for joining us.
Thank you for having me.
I hate that we have to talk on such terrible terms, but we appreciate you authoring and making some observations for us. In a mass shooting like this, an active shooter situation, what would the response be like there on the ground? We know we had 14 people who were killed, but what would that response look like?
Initially when something horrific like this happens, there's generally a tactical EMS unit that goes in. And this is a divergence or paradigm shift from historically what we used to do when we waited for things to be all clear before entering the scene and providing emergency medical services. Those teams are equipped with police officers, law enforcement, and people trained in taking care of acute injuries. So the key there is that you're actually getting to the folks as quickly as possible. We know time is of the essence in these situations. You need to be able to control bleeding, immobilize those that have significant injuries, and triage them on the scene. So routinely what we do is we call disaster triage to see what degree of injury they have and be able to triage those patients and who needs to get out first, second, third, so on and so forth, and get to a casualty collection point or ultimately to a hospital where they're going to be able to get care provided for them.
Yeah, you talked about tactical units going in immediately, Dr. Kaczynski. That was instituted after the Columbine shootings in Colorado when there was a hesitancy to go in with an unknown number of shooters and exactly what's going on. That simply has changed, obviously, and we've had several shootings in the 2 decades or so since. We heard that they've been asking for folks to send blood in. So talk about the necessity for that under these circumstances.
I think across the country, we are always suffering from blood supply shortages, and any opportunity to get folks in the community to donate blood is helpful. But in these situations in particular, when you have a large number of victims that may need large amounts of blood transfusions, what we call our massive transfusion protocol, a lot of times in these situations, you need a lot of blood and you not need it readily available. Now, a lot of times in these situations, the blood that's being donated may not be used immediately, obviously. It needs to go through all the checks and balances that we have to make sure things are safe. But we know there's going to be a pull on the local blood supply secondary to an event like this.
And it's Dr. Kaziny, forgive us, so much happening here, fast and furious,
That's
and so
okay.
much information coming in. But Dr. Kaziny, going back to the need for blood and then triage as well, when we talk about gun wound injuries, right, that is very different than other injuries that we might have to respond to in an emergency situation and triaging and caring for those.
Yeah, definitely. And I think, one of the things that is somewhat of a sad fact, but I know you mentioned Sandy Hook earlier, oftentimes in these horrific events, and in particular in elementary school age children, there aren't many survivors because of the severity of these injuries that they sustain on scene. And so unfortunately, not many of them survive these injuries. I think, first I think of this response and this incident and how horrific this is as a parent of a 4 and 7-year-old. And second, I think of it as a clinician and what it must be like to be in that hospital that received those victims from the scene. Recognizing that, not all hospitals are fully equipped to take care of a large scale mass casualty incident like this. And surely, dealing with the ongoing pressures of the pandemic, the mental health crisis, all of these other things, our emergency centers are definitely pushed to the limits already. So adding something like this on top of that is just only more salt in the wound, so to speak, when something like this happens.
Yeah, and just to compound matters, we're talking about a relatively rural area. This is a town of about 15,000 people, so likely a much smaller hospital, and hence why some of those who survived but were injured were air transported to San Antonio. Dr. Kaziny with Texas Children's Hospital, thank you so much for providing this information to us at this difficult time. Thank you so much.